Hi everyone, I'm Ellyse. I'm the Digital Marketing and Engagement Officer at Bath, and I wanted to get Em and Hetty together today to talk about Mental Health Awareness Week. This year's theme is anxiety, and the week is running from the 15th to the 21st of May. And we wanted to get together to just have a sort of general conversation about mental health and what that means to us, what it means in our work, day-to-day life, and that sort of thing. So if I pass over to Em first, if you'd like to introduce yourself, say your role, and say a bit about mental health.
Thank you, Ellyse. So I'm Emma Fincham. I'm fostering consultant in the Policy Research and Development team in Bath. And when Ellyse suggested that the three of us have this conversation about mental health, I was very pleased to be asked. I think having recently trained to be a mental health first aider, which I'll talk a bit more about, I think, in a bit, but I think my sense is that we've come a long way when we think about supporting people's mental health in the workplace, but also our friends and family. But I still think we've probably got quite a long way to go around stigma and raising awareness and people feeling confident and comfortable to be able to share how they're really feeling with the people around them that hopefully will be able to offer some support or signpost towards some support if that's appropriate.
Thanks, Em. And Hetty, if you'd like to introduce yourself.
Yes, hello, my name's Hetty. I've got a number of different jobs. I'm a social work lecturer at the University of Leeds. I'm also an independent therapeutic social worker. I work mainly with children who are adopted or live with kinship carers and their families. And I'm also an associate trainer consultant for Bath. For a little while, I was the training and consultancy manager at Bath. And when I did that, one of the favourite parts of my job was to run monthly wellbeing sessions for professionals. I think, thinking about the Mental Health Awareness Week, that running those sessions and having those conversations every month with social workers and other professionals about their own well-being, not about the families they worked with, but how they experienced being in the job that they were in, what was helpful, what was not helpful, things that they came across. I think that taught me a lot about what it's like to be a social worker. And then as a social work lecturer, I feel a really big responsibility for the social work students who are going into this career, which I think is a marvelous career, but it's not an easy career. So I feel this real responsibility for us to, yes, I think we've come far, like you said, Emma. I think we need to go further. I'm still not convinced that that social work is necessarily easy on people's mental health.
Thanks, Hetty. Not that you do much then, you're not very busy.
I like to take it easy.
Yeah. Well, I'm really glad. I'm really glad that you've both agreed to do this, because aside from you being lovely, lovely people, we can cover a lot of ground, between the both of you. We can cover social workers, social work professionals, carers, students, children and young people. So we can sort of speak very widely, but no pressure, just whatever you'd like to share. So for me, I hear a lot of people saying that mental health is important, and obviously it is. I do think mental health is important, but we've had conversations before where we sort of think that it's become the sort of mainstream, that mental health is a sort of trend, that people jump on board and don't fully understand or explore that. And by setting up this, I wanted to know if we could go a bit deeper and talk a bit more about the day-to-day. What does it actually look like, whether that's in social work or not, more generally, personally, and what does that mean? So if you're fine to do this, I wanted to start to just explore what you think of when someone says mental health. What's the first thing that sort of springs to your mind? So that was my experience, that I think, we can go a bit deeper and sort of challenge stigma and make it more comfortable for people to talk about, and that's what hopefully we'll be doing today. So what's the first thing that comes to your mind when someone says mental health?
Shall I go first? So I think a few things come to mind. I think that my thinking around mental health is that we all have times in our life, and also sometimes it's about times in one's day, where our mental health will feel quite robust and solid and fairly resilient. And then there'll be other times when there's a fragility and a sensitivity, and there's strain and pressure on our mental health. And that, I think that when those things become, when the pressure is such that it becomes too much, that starts to impact on our enjoyment of life, or our ability to engage in work, or how we have relationships, whether that's with colleagues or friends or family and so on. And I think that we have definitely, like we've all said, we've got better at talking about it. But I think you're right, Ellyse. I think we kind of talk about it in fairly generic terms, that we don't necessarily give people, either equip people or support people necessarily to be able to say, I'm feeling pretty rubbish at the moment, and I'm not sure that I can do A, B, and C. I think as well, when people talk about mental health, I know that I'm thinking a lot about COVID and lockdown and the impact on everybody's mental health around that. And I think about children and young people, particularly those that we are supporting through our work at Coram Bath. And I think that we are doing what we can to think about children and young people's mental health, and also that of our carers and that of our social workers. But I wonder what more we might be able to do to support people with that, because I think we kind of talk about it on this level, but like you're saying, what does that look like in real terms? Where does a foster carer go? Where does a social worker go? Where does a young person go when they're having a particular point in their day where they're really, really struggling, and they're having to mask how they're feeling? And then I suppose for me, what I start to think about is, if you're masking how you're feeling, your feelings and emotions, just to get by, does that then have a knock-on effect? Does that then have an impact negatively, potentially later on that day? Does that then lead to, whether it's substance misuse or alcohol misuse, or self-harm, or feelings of negative feelings towards oneself, or it can obviously manifest in millions of different ways. But it's what does that look like if people are having to put on a facade and mask how they're feeling in a work environment, or a school environment, or a caring environment? Then where does that come out elsewhere if we've not created the right spaces to say it's okay to say, I'm not doing great today, or I'm not doing great this week, and I'm feeling whatever, and I need someone to hear that and respond.
And it's not a quick fix as well. It's not as if like us talking now or anything that, along those lines, like it's not a quick fix that someone can just listen to something and then that's it, it's gone. It's not, it's a constant sort of struggle, if that's the right word, or, day to day, it's there, and it's how you can manage it and how you can have those sort of things in place for you to know, okay, well, I need to do this because otherwise this will happen, or sort of having the resources and the sort of support network around you so that you can actually manage that. So I suppose the good thing about Mental Health Awareness Week is sharing those resources. Like, without a doubt, people will be left, right and centre giving out resources, which we'll be doing as well. But having those in place. So Hetty, what about for you? What comes to mind when someone says mental health?
It's a really interesting question, because the first thing that kind of came to mind is that in my therapeutic work, I'm always saying we're not a brain and a body, and it's separate. We're one system. We're one nervous system. We're one being. So, but it's so interesting how differently people feel about saying that they've got a physical health issue compared to a mental health issue. And I think also how we respond to that. I think if I put myself in the shoes of a manager, and somebody says, oh, I've got a bad back, and I'm prone to having problems with my back, I might talk to them about how do we need to adjust your what you're doing to kind of support you back? But that probably doesn't affect the way that I'm thinking about how they will practice. But if somebody comes and says, I experience anxiety, I'm prone to experience anxiety, what's the response to that going to be? I think we're much more likely to think that that says something about somebody as a person and as a professional, when that's not necessarily the case at all. And I think that is the bit that we need to get through. We can say, oh yeah, we can talk about mental health, and we shouldn't, we should kind of be aware of stigma. But I think, I think there is that kind of unconscious, those unconscious feelings of almost that, somebody's either mentally healthy and robust, or they're fragile. While we don't think that when we talk about a physical health problem, we see those kind of grey areas in between, and that people have good days and bad days. But I don't think our thinking about mental health is kind of sophisticated enough yet for it to be really effective. And then I think it is, social work is a really emotionally demanding job. If you think about, for example, the definition of compassion fatigue is caring too much for too long. Well, how do you apply that to a social work job where that's basically what you do on a daily basis? So I think it is so important in social work. But then there's also, I think, in social work, so much value being placed on somebody who can just get through life and keep going. And I think, ironically, we may be, as social workers, very empathic and understanding of other people's mental health problems, of, the people that we work with. But I don't know whether we apply that to ourselves and our colleagues in the same way. I think maybe there's a feeling, and please correct me if I'm wrong, but I've got a feeling that it might be quite difficult as a social worker to talk freely within your team about mental health challenges.
Yeah, no, I would agree with that. And I think it's interesting listening to you talking, Hetty. It was making me think. I can remember having conversations as a social worker practitioner where people would say, at the point that you stop caring, or at the point you're not caring enough within your professional role, then that's probably a good time to think about, having a break, change a career, and so on. But exactly what you've just described around compassion fatigue, that's around caring too much and for too long. So there's I think you're right. I think there aren't natural pauses, are there? Because even if you finish working with a family or finish supporting a child or young person, you know that you will then be almost immediately likely to start working with another child or young person or family, and that you want to get to know them and invest and celebrate their strengths and understand what their challenges are, and try and see what they might need from your role as a social worker. And it's that bit that you were also talking about, where it's hard to, I think you're right, I think it is hard for social workers to talk to other social workers, partly because of the stigma and what we're talking about, that I don't know if it really is okay to say, I woke up this morning and I felt depressed, or I woke up this morning and I felt anxious. I woke up this morning and I had no appetite, and that's not like me. I woke up this morning and realized I'd been awake half the night, whatever it is. And I think as well, if we're honest, we know that if you're in a team, if you're indicating that you're not doing okay and that you're struggling, you'll probably feel a sense of, oh my goodness, is that going to impact my team members? What does that look like? Does that mean they need to absorb some of my work if I need a bit of time off? So I think that for some social workers, they will be very conscious that if they're not feeling okay and that their mental health is feeling compromised, or it's not where they would like it to be, that they will be mindful of not only sharing that because of the things we've talked about around the stigma that's still attached, and perhaps not having the confidence, particularly maybe if you're a fairly new social worker, And I think also social workers will be really mindful of the potential impact on their team, their colleagues, if you need to take some time off because you need to be signed off work because of your mental health, in the same way that people are signed off work with physical health, like Hetty you were just talking about, and that just is something that's just what happens. It happens to people need time off work for health. I think there'd be some potential worry and concern around what impact that might have on your colleagues, who might then end up picking up some of your work, needing to kind of take on additional cases, supporting families, and there would be some probably real guilt and concern around what that would look like and the impact of that. And I suppose there's something around us helping individuals and organizations to know that, and to be aware of that, and to see what there might be around giving people the space that they sometimes need, which is to press pause so that you're not caring too much for too long, I guess.
So it sounds like there needs to be a lot more organisational sort of responsibility for their staff, and set up sort of either systems or events or, you know, sessions, just so that they feel that support's there. Hetty, off the back of that, I was wondering if you could talk a bit more about the wellbeing for members sessions that you ran, and if, like, what you learned from that. Was there anything that surprised you, anything that you found out, anything that reaffirmed sort of something you knew already, and just a bit in general, how the response was to that?
Yeah, well, we started those sessions when we were still in lockdown, and what we were talking about within Core & Bath, and what I was also talking about with social work, kind of friends and colleagues outside, was that what felt to be really missing was there's opportunities for kind of kitchen conversations. So when you're all in the same office, and then you go in the kitchen and you make yourself a cup of tea or coffee, and you might talk to somebody from a different team or somebody from your team, but you're kind of away from the desk, and different conversations happen. And with working online, people still have supervisions, people still have team meetings, people might, you know, have kind of chats with colleagues, but we felt that those meets, those kitchen conversations, that they were missing. So I was thinking, well, if we have these monthly sessions and kind of have like a national kitchen where we can come together and we talk about our well-being, you know, how are you doing? Basically just people asking each other, how are you doing? And so we picked, every month we had a theme, so there'd be a little bit of delivery on the theme, and then just people sharing their experiences according to that theme. And what was kind of reaffirmed for me is that that social workers really care about the work. They really care about the families. They really care about their colleagues, and that people felt that expectation of just being okay. You know, that responsibility of I'm the person who is supporting, so I should be able to get through this without needing too much support myself. I think that was a really strong message. And it's interesting what you were saying before, Ellyse, about, you know, maybe organizations should take more responsibility for this. Maybe things should change within organizations, because what people were sharing was the kind of the unspoken messages given by organizations about workloads. You know, the kind of official messages might be, and about looking after your mental health. The spoken messages may be very like, oh no, we want to look after you, and we've got an employee assistance program that you can access, and you know, if there's any problems, raise it. But then there were those unspoken messages, like you know, sending emails at 10 o'clock at night, that kind of give that message of you should just work until the work is done, which is never, you know, if we're honest in our area, or you should always be available. You know, managers who say with the best intentions in the world, I'm going on holiday, but if there's a problem, please do ring me. That gives a message to the whole team that you should always be available. You can never switch off from work. And, you know, how many resources there are, you know, people having unmanageable caseloads because either there aren't enough posts or there can't be enough people recruited. None of those things are things that people can fix individually. So yeah, those were just some of the themes that came out of that.
And were people, the thing that's I'm curious about is, like you said, people did share during those sessions, but did anything come out of it that was sort of personal? Like, how willing were people to actually share sort of personally how they were feeling? Because a lot of people might not want to share, and that's fine, obviously. I don't know how much I'd want to share, you know, depending on what you're going through, what point you are, you know, but maybe after that, when you're a bit more comfortable, you're a bit further away from situations, you might want to share. So yeah, so I was thinking that, was it useful for social workers to sort of come together, have a space where they can think, oh, that person's going through something similar that I've been through, and sort of setting up a space for them to do that, especially with things going online and maybe not seeing people in person, they can't relate in that same way. So I was wondering, if was there sort of setting up a session like that, was it useful for social workers to then share what they're going through personally and so on?
Yeah, and I think what was interesting is that often the people who would start to share were people who were comfortable saying, I've had these difficulties. You know, I was off work with stress. I was off work with depression. I was, you know, I've gone through this, and this is what I've done to come back from it. And people, if I'm thinking about those people, they seem to be more, they were more comfortable talking about their experiences, and then had a real kind of desire to share what they'd done to help themselves, because I think they were aware that they weren't the only one. And then because people were brave to talk about that, like you say, in a group with strangers, but we try to make it really safe, you know, to say this is just about you. It's not recorded. We made agreements about confidentiality, and we'd have, you know, we had CEOs in there, we had people from different professional backgrounds, legal backgrounds, medical backgrounds, social workers. But people just came to these sessions just as people, you know, people who are doing a job and who care about the job that they're doing. And the people who are kind of brave enough to start sharing, that then really encouraged other people to say, well, I feel like that sometimes. And, you know, and some things were really shocking, you know, just the kind of, you know, lots of people were talking about things like feeling really panicky and feeling really anxious, not being able to sleep because of worrying about cases, not being able to switch off, just feeling the need to always work. So many people talked about having their laptop on their lap every night, you know, while they might have been watching television with their family, but they're not quite there because, you know, they're in the room, but they're still at work because they're still trying to finish an assessment, still responding to emails, that pressure of always being available. And then it becomes, once you've done that for a while, it becomes quite scary to switch off.
It's interesting listening to you talking, Hetty. It's just making me think about conversations I've had in previous jobs where if you described feeling stressed, that there was then sometimes a kind of exploration from other people within the organization about whether that stress was work related or home related. And I recall those conversations, and I'm just thinking that actually I think we are better at now understanding that mental health, like most things in life, are not linear, and you can't just compartmentalize, and it's not like I'm stressed when I'm at work and then when I get home it all disappears and everything's fine, and you know, I'm a completely different person. It doesn't work like that, does it? But I'm just thinking, because of lockdown and because of now many of us do lots of working at home, we're recording this, all of us individually at home, that some of those maybe artificial kind of boundaries almost between work and home clearly now are very different, if you know, don't really exist. So that whole like, is your stress to do with work, or is your stress to do with home life, or those, that all now is often in one big kind of melting pot, isn't it? And I think actually probably always was. I don't think this is just about as a response to lockdown and working at home and working in isolation and so on. But I do think what it means is that, like you, just when you were talking, Hetty, it was just making me think it is hard to work out. Is it the stress of the work? Is it because I'm working at home? Is it because I haven't got the kitchen conversations and I'm not learning from my colleagues in the same way that you would have done pre-COVID? Is it that I can't switch off because my desk is in my bedroom? Is it that my laptop it's just too easy to send that one other email because that's just popped into my head? And I think some of that, isn't it? Some of it is around how we look out for people, noticing that maybe they're creeping into the blurring is even more blurred than perhaps we would like it to be. I suppose it's around that, isn't it? Noticing some of those signs for our colleagues and our friends and family. And
one of the well-being sessions we looked at kind of messages from research about what contributes to well-being in the workplace, and one of those things that's really important is boundaries. It's boundaries about this is work and this is not work. And they used this in this particular study. They used a phrase of you have to avoid a grey area where you're neither working nor not working. And it is that kind of the laptop on the lap at night when you might be wanting to spend time with people around you, or even, when you're by yourself and you think, oh, this is my time, but I'll just do a little bit of work. And at the same time, I think what's happened with working at home, we're a lot more flexible. So you can go and pick a child up from school, or you can do non-work thing in work time, but then we feel that we need to do more work in our non-work time, and it all becomes one big blur, that there's never any kind of clear boundaries of this is when you switch off and this is your time when you need to rest and recover. Our system needs to rest and recover.
Sounds to me a lot like people, and I know I've been a culprit in the past, but need sort of permission to sort of switch off. Just literally that narrative of sort of, it's okay to close your laptop, it's fine to take time for yourself, you don't have to, it can wait. Obviously, there's guilt and pressure and everything tied into that, and it's a lot more complicated than that. But maybe it is just a bit of practice of giving yourself permission to sort of just switch off and just say, this is my time now, I've done what I need to do, this is it. This is how we're going to go forward. So you recently trained to become a mental health first aider. Congrats.
Thank you.
Would you mind sharing a bit about what that was like, just so people know what it is, what it's about, a bit about why you feel that's important, why you wanted to do it, and why you think it's important for organisations to have a mental health first aider?
Okay. So I first heard about mental health first aid when, in one of my previous jobs, when some foster carers that I was working with went on some mental health first aid training, and I remember them doing the training and then being so effusive and saying, oh my goodness, this training is amazing, I've learned loads, I feel like I'm part of a sort of community of people, and you need to make sure that all foster carers can do this training, it's absolutely vital, it's really, really important. So I kind of, that energy and enthusiasm definitely rubbed off. I definitely paid attention. It was hard not to. They were very, very very expressive in their positive kind of feedback, which was great, of course. And I suppose it made me think, okay, if I get the opportunity to be able to do that within a role, then I'll definitely kind of look out for it. So I guess that was the starting point. And I think some of those conversations with those carers was, it might not be that the child or young person that they were caring for had particularly poor mental health at that given time, but it helped them feel like they were getting some more tools in their toolbox. They felt like they had some more language that they could use, some more skills, some more understanding, some more maybe signs to look out for. And I think it helped them think about their own family. It it helped them think about themselves, their family, the children, young people they were caring for, and kind of foster carer peers and colleagues. So I remember those conversations. Then within this role, there was, you know, some information came around, would people be interested in doing mental health first aid, of course. And one of the team, Louise, said she was doing it and wondered whether I might be interested. And so I thought, yeah, okay. So she and I joined that cohort. And the training takes place over 4 days. It's not full days. They feel like full days because of the amount of information that you're retaining and the kind of the group exercises and so on. And there's a workbook that you kind of work through together. We did it with people from different organizations. I think that helps, doesn't it? Because you get from all different sectors. So not within children's kind of social work, care sector, just all different sectors. So that was fascinating as well, because people come with all those different rich experiences. What was amazing was how much, a bit like you were talking, Hetty, how once that trust and comfort is created, all of us were then sharing our own, I think without exception, probably, pretty much all of us shared our own personal stories, times where our mental health has not been as robust, or we might describe it as poor mental health episodes, or times in our life that were, you know, difficult, tricky. And so those were shared naturally throughout the course. I learned loads from the training. One of my real takeaways was that they talk about a stress container, and that as individuals, we as humans, as individuals, we all have, you know, varying degrees of stress that kind of impact on us all the time. And that for some of us, our containers might be really big and robust and kind of, you know, can withstand quite a lot. And that for others of us, those containers might be much smaller. And the container changes shape, of course, over time as well. It doesn't stay static. But they were saying that once your container gets filled up, once it's full from all of your, you know, from whatever's going on, and there's too much going on, and then you're at that kind of tipping over stage, they describe that then as this, that you will manifest, you will present with certain characteristics or traits or behaviors, both your mental feeling side of things, emotional side of things, but also physical traits or things that you might do. And that as individuals, if we can pay attention to those, it's not easy, but if we can pay attention to it and notice what's going on for us, when we know we're at our stress max, and our containers overflowing, and then those traits or those patterns that we might start to do is what they describe within the course as your stress signature. And once you know that about yourself, and you might know that about someone in your family or your colleague or a foster family that you're supporting, or a social worker that you're mentoring, or whatever, once you start to see that, you can have those conversations, because you can say, when I start doing this thing, then you probably know that I'm a bit maxed out and I might need a bit of support, or I might need to press pause, or I might not be able to chair that meeting, or I might not be able to do whatever. So you can have those conversations, you can know it about yourself, and you can hopefully help other people to feel more able to talk about what to look out for, what sort of things. Like, so for me, for example, I know that if I start almost overthinking what might be going on for somebody and might be worrying about it, and it might be that I'm almost imagining what might be happening for them, that's, if I'm doing that a lot, that's probably a sign that I'm actually, it's a bit of projection going on, and it's actually me I'm worrying about, but I'm putting it on other people. And that's probably a good time for me to pause and go, do I need to stop for a minute? I don't know whether either of you know what your stress signature is, a way of describing it, but what your stress signatures are.
Yeah, well, I've talk quite a lot in my therapeutic social work practice. I talk quite a lot with people about compassion fatigue and burnout and things like that, and I always give this example for you know how I know that I'm edging near that, because I think when you do emotionally demanding work, whether that's professional work or whether it's caring or parenting, I think there's always that risk of you know of edging close to that, or ending up in a state of compassion fatigue or burnout. And for me, it's just when I start to see pain everywhere, where that's my first lens, how I see the world. the first time when I really noticed it very clearly, and I was like, oh, this is like, this should be the alarm bell, is when I was stuck in a traffic jam on the motorway. And there were just 4 lanes of stationary cars, and I looked around me and just people in all the cars. And my first thought was, each one of these people has their own pain. You know, rather than thinking, oh, I wonder what they're listening to on the radio, or, you know, I wonder if they're cheesed off as well, they just want to get home. I just had this really intense experience of each of these people has their own pain and their own struggle. And that was the first thing that I saw about them. And ever since then, that's kind of been my, like, you know, I like that term, stress signature. I suppose I just think of it as like a little alarm bell. That, you know, when I'm looking at other people, and I'm first kind of imagining, you know, the pain that might be there, I think, oh, that's not really how I want to be in the world. That's not the first thing that I want to be noticing in the world. And that's when I know that I need to do something to look after myself.
I think for me, I think it's really interesting, Emma, how you said how you can tell other people what your signs are. I've never thought about it like that before. Like, okay, I can pick up on how I'm feeling, and those like around me probably know, but you know, in like professional, like at work, or maybe a wider circle or friends, like I've never thought before to say, oh, if you see me like this, or if I'm a bit like this or like that. So I think that's really helpful. I mean, mine aren't going to make me out to be great, but I think there's 2 sort of emotional behavioral ones that sort of come out. So one of them is that I'm very, not with everyone, but with certain people, I'm very snappy, and I'm just sort of, when I'm sort of at my maximum, I'm very snappy. I just want to get on with what I'm doing, sort of in my own world, and sort of can't really think outside of that for that time being. And then the other one is that I find I get a bit overwhelmed, that everything is a bigger deal than what it is. Or on a usual day, I can manage what I need to do for that day or that week or whatever's going on. I can manage it, and I think, well, why can't I do it today? And I'm like, oh, okay, because I'm at that maximum. But one that I was thinking about that relates to what you said earlier, Hetty, about physical and mental, is that I find, and I don't know, if I'm no doctor and I don't know, but what I've found is that I get sort of eczema and a rash between my fingers, and I used to get it on and off, and I thought, well, why haven't I got it constantly? And then I saw my stress patterns, sort of when that happened, I get this rash on my hand, and I think, oh, well, that's a bit odd that that's a coincidence that it keeps happening. But when I notice that, that's when I know, okay, I need to take time for myself. I need to reevaluate what I'm doing. This is the final point. This is where I'm at. And then sort of take a back step. So yeah.
And I think just listening to you both talking, it's like it feels quite freeing. I don't know if it does for you too, but it feels quite freeing to be able to say, I know that I, you know, as you were talking then about the physical side, I know what happens to me is my jaw starts to feel painful because it's almost locking up. And we don't have these conversations very often, do we? So it's like being able to have them in what this feels like a safe space. I know we're recording this so that other people can hear it, of course, but it is just by us having the conversation, it is almost practicing that, isn't it? That it's okay to have, you know, everybody will have their own version of what their stress container can withstand, and what their stress signature looks like, or what their alarm bell are like that as well, because the alarm bell is, you can really see it, can't you? And once you've noticed it, it's probably really loud by then, isn't it? It's probably really ringing. And it's, yeah, so just having these conversations is a great starting point, because then you can look out for your work colleagues, can't you, and people you're working with in other capacities. Sorry, Hetty, you were going to say.
No, and I also love this idea of actually sharing that with other people. And wouldn't it be amazing that in the same way that if a colleague would go like that and you'd go, oh, you know, is your neck bothering you? Because you know that they get sort of sore neck. Wouldn't it be amazing if somebody would be like, a bit snappy, or they would just see pain everywhere, or they would be overthinking everything, and you would be able to have that conversation and go, do you know, I just wonder whether you're feeling a bit overwhelmed. I wonder, you know, what's your mental health like at the moment? That would be fantastic if we could just have those conversations, wouldn't it?
I suppose. Go on, sorry.
No, go on.
I was just going to say, like, if you do share those signs, it's sort of the foot in the door for someone to open up that conversation. You don't have to say, oh, I feel like this, can we talk about it? If you shared with that person that, oh, this is my sign, if I'm acting like this, or I'm doing this thing, then I give you permission to approach me to talk about it. And that's sort of the halfway step, that it doesn't feel like this big thing to talk about. But that reminded me of a sort of funny story, and I won't go on too long. But in the last job I had, I would clench my jaw like you, but it would be at night, and I'd wake up in the morning, and I still do it now, but I'd have earache, and I didn't know where it was coming from. So I went to a doctor's, and I thought, oh, you know, it's physical, I can book an appointment, I can do this, I can do that. And then I found out that I was grinding my teeth at night because of stress that would then give me earache. But then the funny part of it is, which is funny now, my manager came into work and said, literally about a week later, and said, oh, I've got terrible earache. I thought, no way. And then I was like, you need to check if you're grinding your teeth at night. And she was. So we both had the same, and we were both on the same project, same job, and both had the same symptoms. But obviously, us talking now, we know that the signs are different for everyone, and the reactions are different. So even talking about it, people can think, oh, I had that, or I didn't have that. But yeah, me and my manager both had the same signs, same stress for the same project, and we both thought, well, actually, now we're in this together, we know what's happening, we can talk about it and sort of do something about it.
And stress and anxiety can have such impact on kind of the physical system, you know, your digestive system, your joints, your muscles, your immune system. All of that is really intricately connected with your stress levels. So if you are regularly experiencing stress, if you're experiencing anxiety, all of those things can really be affected. So, you know, people can have bad backs, or really painful joints, or just catch every cold that's coming, or having a problem with digestion. And it could all be connected to stress and anxiety. And it just shows what, you know, how significant it is and how important it is that we look after ourselves, but that organizations look after their employees as well, because, you know, we want to look after our individuals, but also just the workforce as a whole. We need healthy, well people to do the really important work that needs to be done.
And avoid burnout.
Yeah. And some of that is, like we're saying, some of that is having the conversation, some of it is the noticing, some of it is being able to, and some of it is being able to say, I can see, or I think I can see that you might need to have a break, or have a rest, or have some time out. I'm just thinking about our social workers supporting foster carers, supporting kinship carers, supporting adopters, and feeling confident and comfortable to have those conversations, because it does feel, lots of social work conversations are sensitive, difficult, challenging. Of course they are, is the nature of the work often. But I think this is yet another area where, if social workers are able to kind of acknowledge that the impact that poor mental health might have on being a worker, in the same way it has an impact on being a parent or carer, and then what does that look like, and what, you know, we're here and we're listening, and we've got, you know, whether it's mental health first aiders who you can have a conversation with, and they can spend some dedicated time listening and then signpost. Is it about helping somebody make that phone call to an employer assistance, you know, counselling session? What is it? What are the steps? And I think lots of organisations are getting better at it, but like we're saying, that there is a need for more mental health champions, more, and it not just falling to the champions, of course, but but more ways, more mechanisms that people think, yeah, I know that on my days or time, you know, piece of time that I need extra support, I know where to go. I know who to talk to. I know who's going to listen, and I know who's going to respond and do something that will make me feel like it's been okay to share. Because and it's that, isn't it? It's okay to share that. It really is.
And I suppose an acknowledgement that it's not a weakness. You know, often what we're talking about is the result of, you know, I'll say it again, that caring too long for caring too much for too long. So it's not just something that happens to people who first come into the job. You know, it could be the people who are really experienced, but who've just had so many experience, they've weathered so many storms, and at some point I'm guessing that stress container can just become overflowing. And I think it's really important that we acknowledge that that's not a weakness. That is just something that happens, you know, in the same way that if we keep putting pressure on a bone, at some point it will snap. If we just keep loading pressure on people's mental well-being, there is going to be a point when their stress container is full. And I think, you know, it is so important to look after all our colleagues.
And I think in that it's important to sort of recognise that there's difference between everyone, so that one method might work for someone and that one structure within an organisation might work for one person but it won't for another. But, you know, doing things and getting there one step at a time, hopefully eventually we'll get there.
I always remember that in my very first few months as a social worker, so I just graduated, and then I had a case together with a child protection social worker, and people had said, oh, you know, it'd be really good to work with her because she's been doing it for 20 years, and that's really quite unusual for somebody to be in frontline child protection for 20 years. And it was a really complex case, and I am always very reflective, probably too reflective, and I share what I feel, you know, what goes on inside of me, and I wanted to have a conversation with her, and I started to say, oh, you know, this situation, and then that happened, and I just feel, and she cut me off and she said, no, you can't go around feeling, you know, you're new to this job, and I'm telling you now, if you're going to feel stuff about every case that you deal with, you're not going to survive in this job. And it really puzzled me, because I kind of knew, I just had this knowing that that's not right. I'm pretty sure I should be feeling. I'm not going to follow that advice. But at the same time, I was also intimidated by it, because, you know, people had said she's this amazing person who'd done this really tough job for 20 years. But then looking back, knowing what I know now, I'm thinking, oh God, she was really burnt out. You know, she had that kind of cynicism. She was protecting herself from feeling. You know, that's the way that she was getting through. And she was getting praise for being so resilient and so strong. And so, you know, I remember somebody just describing her as bulletproof. Nobody should need to be bulletproof. You know, she was entitled to have feelings.
And that, yeah, I mean, it's interesting, isn't it? Because you kind of hope that maybe that what you've just described wouldn't happen now, but I can still imagine it would happen in certain teams, particularly if we're honest, when you've got teams that are under huge pressure and work needs to be allocated, families need to be supported, children and young people need to be visited and understood and listened to. And you can kind of see, can't you, that things like taking care of people's mental health might end up slipping because of all those pressures that, you know, that I've just kind of outlined. But I guess it's just keep bringing it up, keep talking about it, keep saying, you've told me you're fine, you know, Ellyse, you've told me you're fine and you're okay, but I'm wondering about that, and I'm going to probe a bit, and I'm going to, you know, have you got time to have a virtual cuppa? Let's not talk about work, let's just chat. I think all of us, that you hear people saying that people need to take responsibility for their own mental health, and of course we do, But sometimes when we're right in the thick of it, we probably need a bit of a helping hand from those around us, don't we? And I think it's okay to kind of take some responsibility for oneself, but I also think we have a responsibility to look after one another, like you've both said. And the more we do that, the more we do the checking out, the more we do the, you've told me you're fine, but that's not what I'm seeing, or that's not what that's not, you can't be fine. I know you were working at midnight and you're here again this morning, and you're you know, there's stuff going on. I guess it's just us keep on having these conversations, isn't it, in the way we have, which feels really, it feels unusual, but it also feels healthy. And I think the more we have them, hopefully the less unusual it will feel, and the healthier we will all feel as well. Win-win.
And I think organizations need to, you know, I agree with everything that you've just said, Emma. I would add to that, organizations also need to take responsibility, because you know, a lot of, if somebody experiences mental health difficulties as a result of a work culture, they individually can't change that for themselves. You know, it needs to have a change of that culture. And it could be something like, you know, having an awareness of the impact of secondary trauma when you're allocating work. So, for example, I used to be practice manager in an adoption support agency. There was a really high trauma content of, you know, a lot of our work. But then there was also work like running workshops or doing parent and child play groups, or speaking at a preparation group, or, you know, if you looked for it, there were also pieces of work that didn't have such a high trauma content. So how do you balance those things out? Because often when people become really experienced and really good at their job, what you start to do as an organization is you give them all the really tough stuff. And you think, oh, let's give the kind of easier stuff to people who are maybe newer. But if you do kind of trauma-informed case allocation and work allocation, you'd think, oh no, this person that's really good at their job and has got really tough cases, they also need to spend time running the toddler group, because they need a little bit of time away from the really heavy trauma stuff. And that is organizational, isn't it?
And I think, yeah, and I think you're right, it is organizational. And it's like you said about running those sessions that you ran when you were doing those well-being sessions, and that messaging is saying, we know that this time is important for you. So as an organization, we're saying to you, you can take that time out, you can take that hour and a half, whatever that looks like, that's within your working day. We are not expecting you to work the hour and a half later. You may well feel that, you may well feel, well, I've got to catch up now, I've got to make up, I've got to do, you know, but as much as possible, it is organizations saying, we get it, you need that time, you need that space, that's really important, in addition to whatever other reflective supervision space that you have. And I suppose it's encouraging, isn't it? When you were describing it, Hetty, it was great that you were saying there were people from all different layers, you know, kind of within management structures and through those organizations and systems from all different levels attending, because that does. I think it's about, you can kind of model, can't you, from, if you think of it in hierarchical management terms, but you can also model across an organization, just saying, I'm going to this thing, it's really useful, it's really helpful, and not kind of doing it under covertly. You know, I'm just creeping off to my well-being session, and I'm hoping no one's clocked that that's what that is in my diary, because now I have to reveal that I might not be feeling my mentally best self, and actually you might be feeling your mentally best self because you prioritize going to that session. So it's kind of reframing it, isn't it?
Yeah, and that's really what we saw, that a lot of people who came to these sessions were people who'd recognized the importance. And I did lots of thinking about how can we get people there who might not have recognized it. And that's, you know, that's tricky, isn't it? But yeah, it's a really interesting point that you've just raised there, Emma, that Yeah, actually, it should be something that you wear as a badge of pride. Yes, I do these things. You know, I take my well-being seriously, and that should be seen as a, you know, as a real achievement. It's something that people kind of look at and think, oh, I'm going to do that.
Yeah.
So, not to take much more of your time, but one last question. Just wondering if you know of any resources that are available, anything you've used, been recommended, anything you can share for social workers, personally, professionally, carers, foster carers, kinship carers, adopters, everyone. It applies to everyone. If there's anything out there that you know about, obviously we've mentioned sessions like wellbeing for members, you know, the first aid and mental health training, all that sort of stuff. Is there anything else that you know about that you can share?
Do you know something to start with, Emma? Because I need some thinking time on that.
Yeah, no, that's fine. So one of the things, well, a couple of the things that they talked to us about when we did the training was obviously most people, if not everybody, will be aware of the Samaritans, and that's an organisation that continues to provide expert support. So we were told that if somebody was, as part of our training, if we were particularly worried about someone, or we weren't able to kind of have the conversation in the there and in the here and now, in the moment, I think is what I mean, that we would signpost them to the Samaritans. And so I've got the card in front of me, and it's, you know, the telephone number is 116123. So we were told to kind of, you know, try and remember that. There's also a organization that's a texting service, so it's called Shout. I think probably lots of people are aware of that as well. I think lots of people benefited from using that during lockdown, and it continues to be a service available. My understanding is that's a text support service, so I think you text, you know, whatever it is that you're worrying about. The text number is 85258, so it's 85258, and then somebody who's trained, who will have done similar to the mental health first aid training, will be responding to that. And my understanding is that you then kind of have a, you know, backwards and forwards text conversation. So those are two things that kind of immediately come to mind. Lots of organizations now are training members of staff to become mental health first aiders, so it is probably a good thing to kind of look out for, but also to ask your organization, ask your managers, ask the budget holders, you know, is this training available? Can we think about it? Can we buy a few places for people? I think that's probably a kind of a good starting point. Those are the things off the top of my head. Well, they're off the top of my head from the training, but I'm sure there's many sort of resources and places you can go to, but I would probably need to go away and look them up.
Well, I can, along with this, any resources that we've got, you know, we've got some books about supporting mental health of looked after and adopted children, and even though that's not directly for the well-being, there we go, Emma's got it to hand, that wasn't even planned. That's one of our best sellers, and obviously that is helping others with their mental health. So any resources that we can think of, we can add afterwards once I'm sharing.
And I think for people individually, if we're thinking about social workers particularly in this conversation, it's, if you look at you know, the professional framework of, you know, the things that we sign up to in our profession, one of them is to recognize if there's something going on for you personally that's affecting your practice, and that you do something about that. And when I used to read that, when I was a social work student, and you have to kind of look at how do you evidence all of that, I felt that was quite restrictive. It was almost a little bit like, well, if there's something wrong with you, you know, make sure that you're still a good social worker. And it almost felt a little bit scary, like, oh, I hope I never have to do that. Many years down the line, and looking at those frameworks again now with students, I see it as really liberating. I see it as, do you know what? Looking after myself and standing up for what I need is part of my professional code. That is what being a good social worker looks like. So to say, I need a little bit of time this afternoon, or you know, whatever I need to not chair those meetings. I maybe need somebody to come with me on this visit, or I you know, whatever it is that you might need, that is actually being a good social worker. That is doing the things that you've signed up to do when you became a registered social worker. And that also means that not taking your laptop out at night, but doing something that helps you, whatever that looks like. It's different for everybody. But doing that thing, it doesn't mean that you're not, you know, you're kind of prioritizing yourself over your work, because I know from the wellbeing sessions that people really struggle with that. They really struggle to put themselves before the needs of their families. But actually, if you go to that dance class, if you go for a cup of coffee with a friend, you can just talk to them. If you meditate, if you go for a run, if you watch, you know, whatever you would like to watch on television that's relaxing, whatever it is that works for you, you are actually being a good social worker, because that's part of what being a good professional looks like, to look after yourself.
Really, really wise, powerful words.
How
Yes.
can we match that? How can we follow that, Hetty? Well,
I've had this chat with social work students.
Oh, I feel a lot lighter after that.
Oh, good.
Thank you both for that. That was very insightful. I think it's going to be really useful for everyone.